Your child just went off to college, you have removed them from your Covered California health plan, but your monthly rate didn't go down. What gives? Hi, I'm Kevin Knauss with InsureMeKevin.com, and it is very perplexing to many families that when they remove one of the family members because they go to college, but they're still in the tax household, their monthly insurance premium doesn't go down if they're getting a subsidy, and that seems odd. And the calculation for the subsidies offered through Covered California, it can be a little bit complex. But in this particular case, there's certain things that are going on, and I don't want to bore you with a whole bunch of different jargon and whatnot, but if you kind of understand how it works, then it'll make a little bit more sense. First off, the subsidies are based on making the second lowest cost silver plan affordable. And there is a particular range that is based on your income. And that then translates into what they call a consumer responsibility or a fair share percentage. So you can see on this graph, if your household income for your family size is 400% of the federal poverty level, then the second lowest cost silver plan should cost no more than 8.5% of your household income. If the second lowest cost silver plan is 10 or 15% of your household income, the subsidy is the difference between the 8.5% and the 15%. And they cut that up and send it to your insurance carrier every month. So let's get into some of the examples, and this will all kind of make sense as to why your health insurance premium does not decrease when you remove a household member that is still in your tax household. So we have a mother and a daughter, age 45 for the mom, 5-year-old daughter. They live down in Southern California, so we have a tax household of 2. The income is $52,260. That puts them at 300% of the federal poverty level, which according to that curve translates into a 6% consumer responsibility, meaning they should pay no more than 6% of their household income for the second lowest cost silver plan, and that is $3,135.60. So, and all of these numbers are pulled from the Covered California Shop and Compare tool. So we go in, the 2-person household, 45 and 5 years old. Covered California says second lowest cost silver plan with a subsidy would be $259.30. The subsidy is $336.93 per month. The full rate, unsubsidized, for the health plan would be $596.23. An annual premium, that full monthly premium times 12, $7,154.76, and we subtract the consumer responsibility of $3,135, which leaves a subsidy of $4,019. So Covered California, they take that $4,019, chop it up into 12 equal increments, if it's for a whole year, and then send 1/12, which is that $336.93 to the health insurance company. Now, that subsidy, just because it's based on the second lowest cost silver plan, you can apply it to any plan, bronze, some other silver plan that costs more, a gold or platinum, but of course you're going to be paying more if you go gold or platinum or a higher cost silver plan. Okay, so let's change the scenario a little bit, where the daughter no longer needs health insurance. Maybe the father is putting the daughter on his work plan, you know, the couple is divorced. So still a 2-person household, still $52,260 income, everything's the same there, except only the mother needs health insurance. We run it through Covered California. The monthly rate actually goes up $1 to $260.30. The full premium amount, you can see there, annual premium is $4,677 minus the consumer responsibility of $3,135 and the annual subsidy is $1,541. They chop that up at $129.45 per month. So the household is still only paying 6% of the income to the health insurance. It's just that the subsidy has been reduced and the mom is paying more of her own health insurance. But it's still a household of two. Now, the $1 difference, Covered California for 2022, every person enrolled in a Covered California health plan, there will be a $1 credit. So a household of two, there will be a $2 credit on there. But there's reasons for that, but that's why it's a $1 difference. Now, let's change the scenario a little bit. Only the daughter needs health insurance. The mom, maybe she transitioned to Medicare because of a disability or something. Still a two-person household, same income, 300% federal poverty level, 6% consumer responsibility. But the daughter's health insurance rate, because she's only 5 years old, $205.48. Annual premium of $2,465.76, which is less than the 6% consumer responsibility. The health insurance is already considered affordable because it's less than 6% of the household income. Therefore, there is no subsidy. So sometimes parents that are divorced share the dependent status of the child. So perhaps in 1 year, the father takes the daughter as a tax dependent, leaving this mother as just a household of one. With the household of one at $52,260, that is 400% of the federal poverty level and an 8.5% consumer responsibility, meaning that she should pay no more than $4,442.10 for health insurance for herself. We go through Covered California, a full monthly premium of $389 minus a monthly subsidy of $2,057. That gives us our $369.18 per month premium. The annual premium, $4,677. 8.5% of the income is $4,442.10. So the annual subsidy is only $234.90. They chop that up into the $20.57 subsidy monthly. So not very much. So a dramatic change when the household numbers change, because that changes where the income falls relative to the federal poverty level. So that can make a big difference, the change of the tax household. So if your child goes off to college and is you no longer take them as a tax dependent, that changes the equation dramatically. But what about older people, retired couples? This particular example, we have a retired couple in Northern California. Their income is $34,840, household of two. That income, household size, 200% of the federal poverty level, and their consumer responsibility is 2%, or they should be spending no more than $696.80 annually for the second lowest cost silver plan. Run it through Covered California. For both of them, insured with the second lowest cost silver plan, they would be paying $56.07. A monthly subsidy of $2,425.41. Whoa! Monthly premium, $2,481. Annual premium, $29,777. But they only are required to pay $696.80. You subtract that from the annual premium. That is our annual subsidy amount of $29,000. Chop that up into 12 equal increments. Now, one of the individuals who is 64 years old turned 65 and is now eligible for Medi-Cal and no longer eligible for Covered California. The tax household is still 2. Just because you're on Medicare, you're still in the tax household if you're married, marrying, filing joint. Same income, same FPL 200%, same consumer responsibility of 2%. Go through Covered California. The monthly Covered California premium only goes up by $1. Although, you know, the annual premiums with the one individual off is like less, that's $15,000, but that did not change what the household is paying for the one person that is still remaining in Covered California. They're paying $1 more because, again, that $1 per person tax credit. But we take the annual premium, subtract the consumer responsibility for that household of 2 of $696. We come up with the annual subsidy of $13,000. Chop that up, and the monthly subsidy of $1,121. Making it $57. But it is still kind of confusing. The one partner left, and but the health insurance cost through Covered California did not change because of the calculation of the consumer responsibility percentage. So the subsidy will decrease as the health plan rate decreases, as long as it's meeting that consumer responsibility. So it'll always, the monthly rate will always float up to no more than that consumer responsibility percentage. So a little wonky, a little confusing. If you have any questions, please leave your comments below. You can go to my website and get my contact information, insuremekevin.com, and send me an email. I'll try and answer some questions, because it is rather confusing and perplexing, and then once you start actually taking members out of the tax household or changing your income, everything gets thrown around once again. But hopefully that's kind of answered some of the questions as to removing someone from the health plan doesn't necessarily change your monthly health insurance premium through Covered California enrollment because of the consumer responsibility percentage. Thank you so much for watching. I'm Kevin with insuremekevin.com.